The first kidney transplant that we did was in August 2010. That was almost 15 years ago. And now is resumption of kidney transplant services. There were so many challenges, but we decided to come back in a way that it will be sustainable. Whatsoever you do, if you don't have a sustainability plan, it makes it very difficult. So when we did the first transplant, it was done in the main hospital theaters, and the patients were admitted in the main hospital ICU, that's the surgical ICU, and also the HLE typing we were doing, we have to send the samples outside the hospital. So over the time we said, why not expand the facilities of the kidney center in such a way that we can do all the things that we need to do here in this hospital. Slowly, with difficulty, we were able to expand the kidney center as of today as the largest kidney center in the country. Why I said is the largest kidney center in the country. One, it has admission facility. In the kidney center, is 85 bedded. So one can admit kidney disease patients up to 85. I don't think there is any kidney center in the country that have admission facility for 85 patients. Not going to the medical ward as urology, as a nephrology, or going to surgery ward as urology patients. They are all domiciled within the same center. And then secondly, why we say we are large, we have 4 operating theaters just for the kidney center. All the 4 can be used for kidney transplant because they are designed in such a way that kidney transplant can be done. We did them in a way that they are twin theaters. 2 are twin in the new extension and 2 are on the old side. And we equip them with modern equipments. All of them, they have in the kidney theaters endoscopic towers. They have their lights with camera. They have everything that is needed within the operating theater to operate for kidney transplant. And even the theater lamps, some of them, they have cameras that you can view it anywhere. And also, we upgraded the laboratory to a level where we can do HLE typing in addition to the basic laboratory. In the past, we have to take the samples to the main hospital lab, but now there is a basic lab and there is HLE typing lab within the kidney center. And also, there is a apheresis machine within the kidney center so that it can separate plasma and blood. There is almost over 20 dialysis machines within the kidney center also. And we have to commend the federal government of Nigeria for the kidney dialysis program. The current government came up with a program where patients can pay only 12,000 for a session. Prior to that, the money is in multiples of this for any patient to get consumables to have the dialysis. But now the federal government came up with a program so that a patient pays only 12,000 naira for dialysis. 12,000 naira for our friend from Paris. We're talking like $8 for a dialysis. This is highly subsidized by the federal government of Nigeria. It's not up to $10 to have a dialysis here. I don't think anywhere. It's one of the world's cheapest dialysis that you can have. And not only being cheapest, but the machines that are available here, they are the same machines that you have dialysis in London, in Chicago, or in Saudi Arabia. They're the same machines. So people may look at it as it's cheap. Maybe some people will start doubting, is it really standard? No. We have to thank the federal government of Nigeria for buying the machines, buying the consumables, paying the salary of the staffs that work, maintaining the infrastructure where these things operate. It's all done by the federal government, free to the people. So I think it's a commendable thing that is happening. Elsewhere, if you go for dialysis, I don't think you can have dialysis anywhere less than $1,000. It's unlikely. So it's commendable step by the federal government. And similarly, the items that we mentioned that were procured to improve these services were also part of the government procurement process. The procurement of these theater items, all the 4 theaters, were procured, equipped by the federal government through the TED Fund project. The laboratories were all done by the federal government through TED Fund projects. So we have to commend again the federal government for providing so much funds to procure those equipments for the benefit of Nigerians and even some people from the neighboring countries. They do come to this hospital. At a time, our cancer center is receiving patients from 6 countries. So I believe it is very, very good. We have to say where it is good. We have to commend the federal government for providing such facilities to the people of Nigeria so that they can benefit from its services. And if you have such things, people like the leadership of the ministry that advocate for this, nothing comes so easy like that, as simple as that. When you have a good minister, he is the one that will promote such programs to Mr. President, who will approve it. So we have to applaud the contributions of the Honorable Minister in ensuring that we have improved facilities for the benefit of Nigerians again. And also, the facilities were facilitated or assisted when Kashim Ibrahim Imam was the chairman of TED Fund. He really helped. So we have to commend him too. And also, His Excellency, the Executive Governor of Borno State, Professor Babagana Umar Zulum, he has been of tremendous help. He is worried about the rampant or increase in kidney diseases in the region. He went to the extent of even providing 50 million naira to do research by our own kidney center to find out why do we have so much patients with kidney diseases. So we have to thank him for coming in at this stage to help out the research to find out the reasons why we are having such things. Most of the things that we see may be preventable. So prevention is better than cure. And to the current one, I think I must commend Professor Alasan and the team members, both the urologist and the nephrologist. You have worked tirelessly day and night to ensure you have performed these kidney transplants. And not only that, but we performed it free to the patients. Free. And there is to do one kidney transplant, it cost about 13.5 million naira. The hospital carried the 8.5 million they provided. But there is a donor that decided that he doesn't want to be mentioned by name. He rather be quiet, unknown, and he paid 5 million for each of those patients that we have successfully conducted the transplant to. And I don't know him, even myself. He decided to be quiet. He donated 5 million so that we can procure the drugs, because not only doing the surgery, but the expensive drugs need to be administered to the patients for maintenance. So we have to thank him, and we have to thank Professor Zainab too for her contribution towards obtaining these sponsors. They have done very well. And now that we have started, and we know it's expensive, University of Maiduguri Teaching Hospital is ready to continue its contribution for the next 20 patients. But we need co-sponsors. For the other 5 million, the patients can buy drugs. Because even if we operate on the patients, if they do not have the immunosuppressants and other drugs, it will be difficult to be maintained. So we're appealing for the general public. If there is anybody who wants to sponsor these patients, all we want is for him to buy the drugs and bring. It's not the money. We don't really even encourage donation in form of money. We want the person to buy the consumables that are required, especially the drugs, so that the patient can benefit from them. For our part, most of the surgical side, we can do it as a contribution by the hospital for the next 20 patients. So we are appealing loudly for anybody who wants to help. Please, I think it's the time that we help. So many patients, they do have end-stage renal disease, but they do not have the financial capacity to go and do these operations. I think I'm appealing on their behalf. Those voices that are voiceless, help them. And for us as a hospital, we'll continue to manage, monitor such patients that we have done operation for them. We will not just leave them after operation. Follow-up of such patients is even more important than the operation. Most of the challenges that happens is immediate post-operative and after follow-up of patients to come and ensure everything is moving fine. We will continue to train our own staff, retrain them, and to give them the best clinical skills that are required.
And as you mentioned, we plan to have it for 20 people free. And as I said earlier, the cost per patient, averagely what it costs us is about 13.5 million naira per patient. But the hospital is putting the bills of almost all the technical operation side. But the drugs are very expensive, post-operative drugs. That's where we need the donors to come in and buy it. In fact, the first donors that made the donation, I told them, please, we will prefer you to give us the drugs. And they went to the agent and they bought the drugs and the consumables and they brought it worth the amount to us, and we gave it directly to the patient. I think that's what we really want. And regarding the cost of the operation after these 20 patients, one thing that I want people to be, to have knowledge about, we are a public hospital. We are not a private hospital. So we are a non-profit making organization. What we charge patients here is only the cost of the consumables used. That's the only thing. so that there will be sustainability in the procedures that we do. Surprisingly, even the machinery that we operate, the charges that we make to the patients cannot maintain them. It cannot maintain the machineries. The government of Nigeria pays the money to maintain the machineries. The only charge that we make is the consumables through revolving funds. We buy the consumables, we divide it to units of procedure or test, and then ask the patient to pay so that we can buy it again. The next patient can benefit from that consumable. That's the only thing we do. So, believe you me, even after the 20 patients, the cost of a transplant here will be the cheapest in the country. If you recall, when we commenced the services in the cancer center, unfortunately, the flood disaster destroyed the whole of the cancer center with 2 linear accelerators, 2 brachytherapies, and a CT scanner. Today, if we have to buy such things, it's over 10 billion naira. But the charge that we put for a linear accelerator is 500,000. And is the cheapest in the whole of the sub-region West Africa. Patients will fly from Lagos to come and have a procedure in Maiduguri, and they will still have some change from what is charged there. Because the minimum that is charged in Lutu was 1.2 million for linear accelerator. In the private sector, it was 2 million. I keep on narrating the last patient on Monday that I saw on the linear accelerator table was a patient, an engineer, Joe, from Lagos. I told him, why did you leave Lagos to come and have a procedure here in Maiduguri, all the way 2 hours flight? He said he went to Lagos University of Teaching Hospital. I told him it's 1.2 million. And not only that, but he has to stay for a waiting time of 2 months. And he went to the private center, they were charging 5 million. But what really made him look for the option to come to Maiduguri, they wrote, subject to dollar fluctuation. Even that 5 million. And then we were charging 500,000 here. And the 500,000 is not up to, if you put it for the whole of the year, is not up to the cost of maintaining one linac. Because averagely, if you have a high-tech equipment, 10% of the cost of the equipment is the maintenance cost annually. When we bought that machine, it was 1 billion. At that time, dollar was 380. And we were not able to raise that money just to maintain it. The government have to pay again to maintain the machine. And somebody, as I said earlier, may think, why is it that cheap? But we have standards, global standard. The Linux we have is the HT Versa and Electra Infinity. Anywhere you go, if you go into London and Paris, it's the same. It's the same machine, of the same quality. I remember when we had guests that came for the Neuroscience and Stroke conference from the Walton Neuroscience Center in the United Kingdom. They said they're using the same machines. So, I assure you, and the people of Nigeria, that our kidney transplant will be the cheapest in the country. I assure you. And I strongly take your advice on setting up like a foundation, like a purpose fund, so that people can donate. And that will benefit the have-nots. It's a very good one. And still, we go back to you, the journalists. You are the one that will promote this. It's that noise that you make that matters. There is the expertise, there is the infrastructure, there is the patient, there are the patients. What is lacking is the funding to provide services for poor Nigerians. And I believe many people have the money within Nigeria that they can donate. So I will leave that as a tax for the journalists. Thank you very much. And in line, I will mention Sir Emeka Ofo. Sir Emeka Ofo single-handedly from southern Nigeria, after hearing the challenges of the cancer center, he donated $1 million US. And we went, myself and the Honorable Minister, to Crawley in the suburbs of London, where the money was paid directly to the manufacturer, Electa. And as I'm talking to you today, the linear accelerator has been installed in the cancer center. We must commend the contributions of the minister. We must commend the contribution of Electa company, because of the disaster, they decided to give us 50% of the cost of a new machine to replace our own machine. And the Vice President of Nigeria too, we have to, Senator Kashim Shettima, we have to thank him for facilitating this. He really facilitated this, and he really facilitated the bringing of the program for the subsidized kidney center to University of Maiduguri. We have to thank him. And New Central Kirawa made mention about statistics. Thank you for the commendation. I think the question is similar to Yunusa of Yerwa. They're similar, it's all research and statistics, they go hand in hand. From what we see here, many of us were thinking there is something in Maiduguri that really leads to renal diseases. That's the average perception. From the funding, the preliminary research indicates most of our patients, I believe, following discussion with the lead researcher, is still diabetics and hypertension, worsened by dehydration in our own environment. But again, there are some mineral challenges, what is delaying the outcome of the research. Toxicology is a very large field that you have to be very careful and meticulous in looking for the toxins. I think that's the stage they are now. Soon, I believe, after they have already taken the samples, they have sent it for laboratory analysis to find out the exact toxins that is here. But the prevalence of hypertension, diabetics, they are the really. We are changing our lifestyle. Before, people partake in physical activity. But now, with the taking of the modern lifestyle, sedentary, sitting in offices, less physical exercise, blood pressure will shoot up, hypertension will come up, stress of life. Yeah. And also the weather itself, it doesn't help. So during the hot season, let's take water and water and water and water to be hydrated very well. So the statistics have shown, as I mentioned to you, and also my friend Timothy mentioned about the first transplant. and the lessons that were learned from the first transplant. If you recall, I mentioned to you the drugs are very, very important in sustaining any kidney transplant. It's so important that the surgeon can do an excellent job. But if that maintenance drugs for immunosuppression is not there, immune boosters are not there, proper right medication are not there, there will always be a challenge. That's why in this particular case, we said the donors should help us buy the drugs for the patients. These drugs that we bought, it will last them for a long time. And subsequently, most of the challenges that kidney transplant patients have is lack of maintenance of these drugs and the presence of comorbidities. When there are other challenges, what may have killed the patient may not be even the kidney transplant. It's another different challenge. So one have to do proper follow-up, proper checking from time to time in a prescribed manner. And enough money should be available for maintenance drugs. This is very, very, very vital. The patient have lived for many years after the operation, but certainly we will not say there will always be a time for somebody to go. Certainly. But his quality of life, he has lived longer.
7 years.
7 good years.
5 months, 13 days.
Yes, the patient, the first patient that we did lived for 7 years, which is really a good one. Okay, as I said, 2 things, maintenance drugs and comorbidities. That may be a challenge, but I doubt if his demise is related to the kidney transplant. So I think that's but certainly we are learning. For us here, we're always open to learn where it will be better for all Nigerians. And that's why the lesson is ensure that there is enough money for the patients to get the immunosuppressants that will last them for long.